Good afternoon. Welcome again to Old South. My name is Zara Jacob, and I'm the Visitor Services and Program Assistant. And as we wrap up our 200th anniversary celebration for Mass General Hospital, I'm pleased to welcome Jeanette Ives Erickson. Massachusetts General Hospital was founded in 1811, and through its 200-year history has provided state-of-the-art medical services on the premise that any person in distress is a neighbor. At the heart of this sentiment is the hospital's nursing staff, who are directly responsible for their well-being of the patients. Jeanette Ives Erickson is Senior Vice President for Patient Care and Chief Nurse at Massachusetts General Hospital. She earned her Doctorate of Nursing Practice in 2011 from the MGH Institute, for which she also serves as a board member. She will be discussing the evolution of patient care and the challenges the nursing staff face at MGH, both in the past and in the present. Please join me in welcoming Jeanette Ives Erickson.
Thank you so very much. It's really a pleasure to be here. I recall when I moved to Boston in 1988, this was one of the attractions that I put on my must-see list so that I could learn the history of this wonderful community. I never dreamed that I would be a speaker in this fabulous establishment. And it's places like this that help us to really understand the importance of history. And I of course, think that one of the important aspects of history is to understand the history of nursing. Nursing, my profession, is really aligned, very much aligned with the mission of the Massachusetts General Hospital, where we pride ourselves, we dedicate ourselves each and every day to providing the highest level of care to the many communities we serve. But one of the most precious parts of our mission is in fact the educational aspect of the work we do. We are well known for our medical education and for educating a fair number of physicians who practice throughout the world. One of the things we're not as well known for is the education of our nursing staff or nurses who practice throughout the world. So I wanted to make sure that my time with you today was spent connecting you not only to the clinical aspect of our mission, but also the work we do in educating the next generation of nurses. Nurses also are aligned with the mission in the conduction of nursing research. Also a little known fact that nurses have a major role in taking research and ensuring that their care is based on evidence, that it's not based on opinion, that it's based on evidence. And in fact, our nursing staff are very engaged in work throughout the world, and I will touch upon that as well. In 1810, as you know, or you can imagine, healthcare in Boston was by all measures less than rudimentary. There was no organized system of healthcare, and there was actually no general hospital, not only in Boston, but there was no general hospital in all of New England. Those who could afford care were treated in their homes. Nurses at that time were virtually untrained, as there was no formalized school of nursing, not only not in Massachusetts, but there was no school of nursing in the United States. And so the poor were cared for in what was called the almshouse, or referred to as the poorhouses. It was becoming clear during that time in 1810 that Boston needed what was called a middle ground between expensive private medical care in the homes and better care than what was being delivered in the almshouse. So on March 8th in 1810, Reverend John Bartlett, chaplain of the city's almshouse that provided care to the poor, met with notable Bostonian physicians, John Collins Warren and James Jackson. They discussed the possibility of establishing a hospital here in our wonderful city, a facility that could offer health care to the poor and to the most vulnerable, and to provide a place for medical training. The next day, after that initial meeting, the men penned a letter stating their intentions to form a committee to, and I quote, "consider and report on the expediency of establishing a general hospital." So Dr. Jackson, oh, that is fast, isn't it? Didn't look like that on my computer. So Dr. Jackson and Dr. Warren. Okay, you're welcome. And this is, of course, the letter that I described. On August 20th, still in 1810, Jackson and Warren distributed a letter to their friends, colleagues, and prominent citizens of Boston articulating the need for a general hospital and requesting financial support for what I would call an ambitious undertaking. They also recognized the importance of nursing, and they wrote, and again I quote, "Above all, the patient suffers from the want of the first requisite in sickness, a kind and skillful nurse." So that set the stage for the changing, or what I would say is the foundation for the nursing profession. Their efforts were successful, and on February 25th in 1811, the Massachusetts legislature granted a charter to establish the hospital. An embargo closing all American ports to foreign trade, along with the War of 1812, delayed the opening of the hospital by 10 years. But on September 3rd in 1821, MGH admitted its very first patient. The earliest known documentation of a nurse being hired at the MGH can be found in the minutes of the hospital's visiting committee, and these notes are dated October 18, 1821. It is believed that the nurse was the wife of the MGH's first patient, and it appears she may have sought work when her husband could not pay his bill of $3 per week. During this period, nurses were untrained, and one early description paints what I would say is a dismal picture. Nurses were described as being of the poorest grade. Women, and this is a quote, "Women such as you would not have admitted to your own household, but some of them were kind and good. They had no teaching, just what they could pick up by experiences or listening to the doctors, and the patients were cared for by rule of thumb. If the nurse was kind, the nursing care was fairly well done. If not, the poor patient was neglected." In the quarterly record of the MGH School of Nursing's Alumni Association, we learn that the night nursing was extremely poor, only one woman to a large part of the hospital, and the patients got along as well as they could, and they helped each other. But there was a great lack of proper care and a lack of discipline of the nursing staff. The wages of a hospital nurse were $2 a week. Among those ordinary nurses, there's shown out some who are born to the work and have never had their superiors as fine nurses and comforters of the sick. One of the oldest photographs of an MGH nurse is of the highly regarded Miss Rebecca Taylor, who is pictured here. She began working at MGH in 1826 and retired 34 years later. On November 10, 1860, Dr. J. Mason Warren requested that the hospital trustees place this photo of Miss Taylor in the trustees' room. On the back he wrote, and again I quote, "For 34 years a nurse at the Mass General Hospital, was 60 years of age when she left the hospital in October 1860, had the charge during the 34 years of 4,000 patients given to the hospital by J. Mason Warren." I'm proud to say that during the bicentennial year, or the year before the bicentennial, we spent a fair amount of time looking for her photo, and we found it. And in coming weeks, she is going back into our trustees' room. And through the reflections of Miss Mary Elizabeth Norris, who was a nurse at the MGH from 1861 to 1868, we get a glimpse of nursing practice in that era. And this is a quote from her. "We had no preparation for nursing in those days. I had never been inside a hospital. I was only 18 years old. We wore no uniforms, just a simple dress. I came to Ward 23 feeling very much frightened." The nurses slept in a little room between the wards, which was used during the day as a thoroughfare between wards 23 and Ward 29. The day nurses began work at 5 o'clock in the morning, had breakfast at 7 o'clock, and finished their day's work at 10 o'clock at night. The pay was $9 a month for assistant head nurses and $13 a month for a head nurse. Mary Elizabeth Norris said, "I was head nurse on Ward 29 from 1862 to 1868. I was there during the Civil War. There were 21 patients, and I had one assistant and sometimes two. A ward tender gave the baths to the men's ward. The doctors did all the dressings. The nurses swept, dusted, made the beds, and gave baths. The head nurse gave medicines and was responsible for the diets. There were no classes. One nurse taught another simply what we knew." Georgia Sturdivant said, "As a head nurse of Ward 29, every 2 weeks I had to send up a tray to the operating room. On it were bandages, compresses, hot oil, and pincushions with the needles in it. The ward tender got the instruments out of the case and spread them on the table. After the operation, the nurse cleaned up the room and carried the blood-stained bandages and linen to rinse them out. There was actually a place called the Rinse House where she rinsed all the blood out before sending it to the laundry." The history of the development of the MGH truly parallels the history of modern-day nursing in our country. As MGH grew, as Boston grew, so too did the profession of nursing. From the early days, we see the nurse as spectator. During this operation, the nurses sat and watched. Sophia French Palmer, who was in the School of Nursing class of 1878, helped to establish the American Journal of Nursing, which remains to this day the premier nursing journal. So the premier nursing journal, not only in this country, but in the world, was established right here in Boston. Annabelle McCrae, in 1923, was installed as a full-time instructor of practical nursing procedures at the MGH, and she published the Procedures in Nursing, Setting the Standard for Nursing Competency-Based Practice. This book advanced nursing by light years. It was distributed throughout the country, and for many generations after, the textbook was updated and published and was considered the gold standard as a nursing textbook. In 1940, Ada Plummer became the first to hold the title of IV nurse, or intravenous therapy nurse. She later co-founded the National Intravenous Therapy Association, now the Nurses Infusion Society. Now, what I want to do is to take a look at the second important focus of our MGH mission, which is education. In the late 1800s, Georgia Sturdivant, who I quoted previously, was widely regarded as Mass General's last untrained nurse. Not a title, I'm sure, she wanted. She was on staff at MGH from 1862 to 1894. After just 2 months' employment, she became head nurse of Ward 29 and C at a salary of $13 a month. She ultimately rose to the position of matron, and in her words, one of the results of the war, which was the Civil War, was to bring our hospitals more prominently before the public, and called upon urgently for the much-needed improvements, not only in the construction of the hospital, but also in the way hospitals were organized. She wanted to make sure that facilities for educating nurses, especially women, really included the care and the art for the sick. An art which up to that time had apparently been by intuition, and nurses being blamed for ignorance if they failed in some point. And in fact, there are notes about nurses being reprimanded rather than being complimented on what they knew. So now enters the Industrial Committee of the Women's Educational Association in Boston, which in 1872 brought together a group of what I believe are visionaries who played a critical role in establishing not only nursing education in Boston, but establishing standards for nursing education in the entire United States. The association was seeking new occupations to help to support women. Miss Sarah Cabot, whose brother was a physician at MGH, suggested establishing a training school for nurses. Miss Cabot was director at the New England Hospital for Women and Children and knew of a nurse training program being started there. In May, the members wrote to the MGH trustees, and this says, in quotes, "The undersigned propose to establish a Boston training school for nurses, which shall furnish for hospitals and private families a better class of nurses than can now be obtained. They believe that a carefully guided apprenticeship and an intelligent oversight will do much to raise the standard and ability and fidelity, and that personal sympathy and a good organization may adjust in leading women to look upon nursing as a desirable profession." So with the exception of Miss Cabot's brother, most of the physicians at MGH were not in favor of a school for nurses, nor were many of the trustees at the hospital. They did not feel nurses needed to be educated, nor did they feel women needed to be educated. After some talk, they consented reluctantly to let us try our experiment within the 4 wards. And then they had applicants to the School of Nursing, and the school was then started on November 1st, 1873. And this is where they were fortunate to recruit Miss Linda Richards, who was in fact the first trained nurse in the United States. With Miss Richards' leadership, the evolution of nursing as a profession began to emerge. She began to teach on the wards and began to teach in the classrooms. She also taught everyone the importance of having a patient record. And there she is again. And here are some wonderful photos of early nursing students. And this is her teaching a class of nurses. In 1877, Miss Richards left Boston and headed to London and Edinburgh to understand the work of Miss Florence Nightingale, who is believed to be the true founder of modern-day nursing. Today, we've created a culture regarding the importance of lifelong learning. Today, nurses learn practicing on mannequins, not on their patients. And nurses really go to school same way other health professionals do, to earn their bachelor's degree, their master's degrees, or their doctoral degrees. Nursing research is a major component of the MGH mission. At MGH in 1925, the hospital opened up its first research ward where patients who wanted to participate in research studies could join us, and nurses were an important part of that work. Today, the Yvonne Munn Center for Nursing Research at the MGH focuses on promoting nursing science through the development, use, and evaluation of nursing research. You would be proud to know that the MGH has one of the best nursing research programs in the country. Most recently, we received funding from the federal government to study the care of the elderly. And we wanted to understand, was there a difference in the care that older nurses provided to older patients? We had wonderful outcomes that say that there was a wonderful bonding and advocacy between these nurses and their patients. And now this study is being replicated in 12 hospitals around the country, and the AARP is our sponsor for advancing this work. Ethics is also an important part of our work, dealing with ethical dilemmas, especially at end of life. And we recently wrote a proposal to the federal government to help us to fund us for studying ethical dilemmas. And I'm proud to say that that funding has just been realized, and perhaps next year I'll be back to talk about the results of that study. And the fourth part of our mission is, in fact, the community outreach and humanitarian work that we do. Because, of course, remember, Warren and Jackson's famous quote is, "When in distress, every man becomes our neighbor." One of the earliest accounts of MGH response to a crisis was during the Spanish-American War. Between August and October, the ships made 3 round trips to Santiago, Cuba, and MGH nurses and physicians were on those ships. We also responded to Halifax, that famous explosion in Halifax that has led to Halifax sending Boston Christmas trees to this day, and that was because of our city's response to their dilemma. We also responded to Ground Zero. After the terrible attacks on September 11th, within hours of the attacks, busloads of physicians and nurses left the Mass General and spent months in New York City caring for our wonderful American policemen and firemen. Early in 2004, when a 6.6 magnitude earthquake devastated the country of Iran and killed more than 30,000 people, MGH nurses and physicians were among the first who responded. And this was the first U.S. official delegation to set foot in Iran in over 25 years. In 2004, we responded to the bloody conflict in the Darfur in the region of the Sudan. And this is one of my staff nurses who spent 6 months working in the Sudan doing education to help people to understand how to care for themselves and, more importantly, how to purify water. We responded to the tsunami. I actually was privileged to go to Indonesia after the tsunami hit to see the wonderful work that was occurring on the Project Hope ship with our doctors and nurses. And as we come to the end of our hospital's bicentennial year, we're facing new challenges and opportunities for nursing. We face healthcare reform, but our approach is to advance the profession. We are looking at how to take our beautiful new hospital facility, where most of the patient rooms overlook a healing garden, and we want to look at how we advance holistic care. We reflect upon our work by inviting people in from hospitals around the country to evaluate us, to tell us how we are doing. And as we look back at the earliest days of the MGH and we flash forward to our present day work, we see that the MGH mission has endured and remains a part of our culture. It's part of who we are as nurses. The dedication to providing the highest quality of care, to educating the next generation of providers, to advancing that care through research and serving the many communities, not only in Boston, but around the world. Thank you so much for giving me the opportunity to be here with you, to talk to you about a profession that I love. I didn't tell you, I actually have the best job in all of healthcare because I get to work with such incredible nurses. So it's always great to tell their story. Thank you.
Okay, we do have some time for questions. I'm just going to ask everyone, make sure that you wait for me to come around with the microphone so that we can pick it up on the video so that others will be able to hear.
I'd just like to ask about home nursing. It's becoming so vital. Where I live in Attleboro, most of us much prefer if there's a home nurse because there's no room at the hospital and it's a bad one anyway, and it's so terribly expensive.
Yes.
Does Mass General train
Not
home
only
nurses?
do we agree with you, we actually are leading a study connected with the federal government, connected with Medicare and Medicaid, looking at how to keep people in their homes and connecting people in the home with nurses who are really, we're calling them care managers, and you are connected with those nurses through technology, and nurses are calling patients in the home at a minimum on a daily basis. What we have discovered is that we are not only keeping patients in their homes, patient satisfaction is very high, and we have significantly reduced healthcare costs, and the outcomes are incredible. Now, our work over the last 2 years is being replicated in several hospitals here in Boston, and we're hoping to take it to a national level. We agree with you.
Yes, I wanted to ask about male nurses. I know you pointed out in the beginning, before there was training, women sort of with no training would do what they could. But when it became in the 70s and 80s more of a in 1870s and 80s more of a profession, did it sort of fall in the category of things like of teaching, where it was associated somehow with women as opposed to men? And today, is that changing? What percentage of the nurses today are men?
So nursing still remains a female profession, very attractive to women. And we probably have about 10% of our workforce. There are 4,000 nurses at MGH, and about 10% of our workforce are men. And my experience is that most of the attraction or the recruitment of male nurses comes from the military. So people who have served as medics in the military are attracted to nursing school, or we are able to recruit people from the military. And we've done a lot of work going into high schools to attract young men into the profession, but still primarily female.
I just wanted to ask you, you mentioned the salary was like $8 a week, but what is that compared to? What were other people making at that time?
So my understanding is that, and I've never been able to find firm dollars, but my understanding is that it was extremely low. At least, double that. Maybe quadruple that, depending on their stature and where they were with the training. This woman here has a question, but it was very low in comparison. Thank you.
I have two, actually. Where did Miss Richards get her training? The original nurse who established nursing?
Yes.
And the second one is, how do you have available enough nurses to go to the emergencies? It's wonderful, but you must keep extra people on staff just for that purpose.
Yes. Ms. Richards, thank you for that question. Ms. Richards received some training from the Nightingale School of Nursing in London, but also remember the MGH was the third oldest hospital in the country. I should have said that in the beginning. So she also went to the other two hospitals, Hopkins and Pennsylvania, to get some training. Thank you. Now, as it relates to our humanitarian mission, this is the part about the Mass General that we absolutely love. When there are disasters, whether it's in our own country or whether it's around the world, we have a team of people that are trained, and as I tell people, they always have a suitcase packed under their bed. There are about 100 of them, physicians and nurses, and they go. There's never a question, and their colleagues cover for them. There is never a question. The hospital is never short-staffed. It is understood within those teams, you go and I stay here, and I will work your shifts. And it's a beautiful thing, and I'm not sure you would see that everywhere. It's beautiful.
Apropos of male nurses, do you recognize Walt Whitman as the first male nurse?
You know, I don't think I knew that. I don't think I knew that. I need to go back to my history book. Do you want a little history for us?
He supposedly nursed during the Civil War. I don't really know a great deal about it, but I remember reading that somewhere.
So I'm coming back to do an ethics presentation and a little more on Walt Whitman. I want to read about that. Thank you for that. I love history, so I would love that.
Are there any other questions?
This is wonderful. Thank you so very much.
Thank you
It's
very
good.
much, Jeanette.
Thank you.